Hello, my name is Sari Fresquez. Today I will be talking about the completion of my applied practice experience addressing the importance of food insecurity for dialysis patients and how I was able to incorporate my public health background throughout this experience. The objectives that I will be going over today include an introduction about where my APE was completed as well as some of the projects. Second will be some major work projects that I completed while I was doing my AP experience, the activities that I completed, and how I can make a connection to these activities. And lastly, a conclusion and a self reflection based off of my experience through my actual internship. So, this presentation focuses on the overall impact of food insecurity and the lack of health literacy in underserved communities for dialysis patients in Portland, Oregon. The purpose of addressing food insecurity for dialysis patients is to improve their health outcomes and to address the treatment effectiveness. Food insecurity for this population is a critical public health issue with serious consequences for these patients. Um, Similar to a domino effect, food insecurity can cause many comorbidities like diabetes and cardiovascular issues, um, which may lead patients to different stages of chronic kidney failure over time. It is extremely important that we communicate diet and nutrition as our patients have many food limitations, which may lead to serious and rapid hospitalizations or even death. This continuous project will allow me to not only support a very culturally diverse population, it will also allow me to provide simple foods for many of our unhoused patients as well. So the location, um, there's many locations that I completed this internship at. There's a total of five Fresenius medical care kidney clinics within the Portland area. My main um, location that I did it at was the clinic that I actually work at. This is called the Rose Quarter Clinic. I was under the supervision of our clinic manager slash our facility administrator. Her name is Melita Vu. She's been in dialysis for the past 15 years, so she was a good mentor to be under. Um, as far as myself, my role as a student varied because I do work on the front end of healthcare for the organization for Fresenius as a certified clinical hemodialysis technician. However, my role as a public health student focused on much more of the back end of the clinics. Um, I was able to, throughout my role, um, such as it's laid out right here in these bullet points, I was able to contribute to the reconstruction of a community disaster drill plan um, for high acuity and unhoused dialysis patients. Um, all of my contributions as the students have provided me with the necessary understandings and tools to continue my project with understanding of the public health challenges my patients face daily. I see patients daily that face a lot of food insecurity, um, and just because our culturally diverse clinic is in need of some form of intervention for this type of issue that they're having currently. So I was happy to be part of this experience and my role as a student as well as a dialysis technician really solidified my role here at this clinic. So the major work projects that I worked on competency 16, 17, and 18. I felt that these three competencies allowed me to really provide some background based off of how our patients are dealing with food insecurity and health literacy, and then how I was able to implement some type of interventions, as well as collaborating these interventions with our social workers and our dietitians. So the first major work project that I completed was a disaster drill plan. The current disaster drill plan does not incorporate for those patients who are high acuity. Um, this is also important because of health literacy. A lot of our patients are um, non English speakers, so I wanted to provide a disaster drill plan that implemented those for the non English speakers. Um, So, because I wanted to emphasize the importance of food insecurity of ethnic and minority groups and reasoning on why they have a higher percentage of food insecurity, that they may be led by the lack of health illiteracy. Um, so, essentially, I developed a community disaster plan in case of an emergency. The three that I focused on were fire, an earthquake, and ice storm. Um, Within the Portland area, this is relatively the most common things that we would see, especially ice storms. In the past couple of winters, we've had severe ice storms, um, and this can cause a lot of displacement for our patients. Um, so I emphasize the challenges of displacements for the dialysis patients, um, and their need for support during this type of displacement. This disaster plan is a communication tool that both the staff and the patients may use during an emergency or disaster. If you notice on the same page, I developed a hazardous vulnerability assessment. This assessment um, allows the patient to see immediately which one is the highest um, for a hazard issue, but it also follows into providing the patient and the clinic with a checklist for each of the disasters if they may happen to be. So on this slide, we'd see that there's a checklist for clinic responsibilities as well as patient responsibilities. Um, this is something that the clinic can print out and hand to the patients immediately, so that way they're able to check off of things that they essentially need. Planning ahead is extremely important, especially for our patients, because they are on treatment for 3 to 4 hours every other day. So making sure that they have their medications, making sure that they have their emergency contacts, and if housing is an issue, that we have resources provided for them, such as our resources page right there that I developed with local shelters, food banks, as well as hospitals. Um, my next project is the highlight of all of the work that I completed at my internship. It's food insecurity support. Um, I completed this through um, both competency 16 and 18. I really wanted to be able to collaborate and use my leadership skills to get with local social workers and dietitians and hospitals to come up with a very short-term solution that we can implement long-term, um, specifically for those who are culturally diverse. I really, really wanted to emphasize the the issue with the bridge that's gapped right now with culturally diverse patients and their struggle with missing treatments and or not being able to receive food because of this issue. So there's many barriers between um, food insecurity support and health literacy. Our very ethnically diverse patients, come to me every day and ask to learn more about dialysis and kidney failure overall. However, they're ill informed based off of their visits to their nephrologist or even just having a language barrier between the social workers and the dietitians. Um, but these are some of the factors that lead and contributing factors that lead them to chronic failure. Um, So I wanted to cover some points on the barriers of these issues. So for the first one, you see language barriers. Um, Language barriers often hinder understanding of dialysis instructions, medication use, and a lot of their dietary restrictions. Many of them have cultural beliefs. Their cultural beliefs may influence perception of kidney disease. um, we have patients who are not able to get certain medications based off of their religious background, such as being Muslim, and we're not able to administer heparin, which is a blood thinner medication, because it has a pork product. So that's very important for them to understand. A lot of them have limited access to translated educational materials. So if no one is able to translate to them other than an actual computer, sometimes things can get lost in translation. There's stigma and fear behind it. Culturally, there are some cultures that the men may not be able to get health care based off of it being a quote unquote look or stigma that they have in there, as well as there's fear because of the cost of healthcare. Lastly, there's a lot of family involvement. We do have a lot of patients who are not from the U.S. and none of their family lives in the U.S. with them. Maybe they have a couple immediate family members, such as their child or their sibling. However, the majority of their family does not live here, so they are less likely to come to treatment because they don't feel as though they're supported. Um, and that includes, with their health literacy, somebody not being able to translate their treatment plans as well as they should. So I created these flyers. They're very um, I created these flyers during my EP experience, which were implemented into the clinic. I do believe that these flyers are a good representation on the importance of missing treatments and um, what may be the causes of the overall ties together with health literacy. If the patient is ill-informed about their treatment and or the types of food they are eating based on factors like language or cultural differences, this can cause the patient to have severe health issues in their dialysis treatment, short term or long term. Um, Essentially, when patients can understand medical information in their preferred language, they are more likely to manage their chronic conditions effectively. Without accessible communication, non English speakers patients may face increased risks of hospitalizations and a lower quality of life. So it's important that we promote health literacy in all languages because it not only improves individual outcomes, but it also strengthens public health by fostering, inclusion, trust, and informed care in multilingual communities. Um, so I think the biggest goal that I had during this internship was um, understanding why food insecurity is causing issues and how food insecurity limits access to dialysis. Because sometimes I don't think that healthcare sees the the, the issue between those two and how they're related. So how can food limit treatment? So this project was supported by 3 to 5 Fresenius clinics, kidney clinics in the Portland area, with collaboration with the social worker as well as a lot of dietitians. So 6 things that we can look at that have caused or have um, food insecurity has limited access to dialysis. Number one being transportation. Patients may prioritize spending limited funds on food over transportation, and at that being that they would not be able to get access to their treatments because they have to choose, either it's they pay for food or they pay for transportation. Second, poor nutrition. Food insecure patients often have diets with high sodium, phosphorus, and potassium, which can lead them to unstable lab values and can also, unfortunately, put them in the hospital because of their high levels um, of potassium, phosphorus, or sodium. Number three, an increased fatigue of weakness. Um, Many patients struggle with, not being able to come to treatment because they don't feel very well. But this is, like I said, a domino effect. They usually will eat terribly based off of the lack of resources that they have. And then it causes them to have a lot of health issues, and then they're not able to come to treatment. Um, Number four, some just are incapable of, the taking, the medical advice. Patients may skip medications that require food to be taken with them, such as phosphate binders. These binders are required to keep their phosphorus down, and if they don't take them because of financial issues, then it can also stray them to be hospitalized as well. There's a lot of structural barriers. Um, so with structural barriers, some assistant programs like SNAP don't necessarily cover the renal specific foods, and it may be difficult for them as patients um, to get the food that they need, which can frequent them in becoming ill. Lastly, there's a lot of mental health restraint. The stress of food insecurity can worsen depression or anxiety, reducing a patient's motivation or ability to consistently engage in treatment. So, how do I address limitations? Number one, I created flyers about the understanding of food insecurity in many languages. There's some facts on there that allow patients to see where they fall into. It also gives them, some examples based on maybe they have some personal experiences with it, on why they're missing treatment and what kind of food is causing them to be, the issues that are causing the food insecurity in itself. Through this whole process, again, I collaborated with social workers, our clinical manager, and the dietitians. But overall, by addressing food insecurity through targeted interventions and programs can help improve health outcomes for dialysis patients. These programs and flyers can provide nutritional support, transportation assistance, and other resources to help individuals overcome the barriers um, in resulting to adhering to treatment plans. Some potential interventions for this, um, with help from local clinics, we developed possible interventions that may help patients, which include nutritional focused transportation vehicles. Maybe we have resources where, like Meals on Wheels, are able to provide nutritional dialysis friendly foods to them. Um, Maybe there's like a mobile dialysis food bank that maybe we can develop within ourselves. But these were just ideas and potential interventions that we developed based on my concern overall. My second project, and this may be my favorite part of my AP experience because I came up with an idea that was implemented at the clinic and is currently in the developmental phase. Um, I developed a food bank for dialysis patients. Um, I feel that it's a critical step toward addressing the interaction of chronic kidney disease and food insecurity. Um, Many patients on dialysis struggle to afford or even access foods that meet strict dietary guidelines. People, putting them at risk for poor food health outcomes. I think a specialized food bank can provide kidney-friendly groceries, low in sodium, potassium, and phosphorus that support treatment and nutritional needs. Partnering with local food suppliers, healthcare providers, and community organizations um, may help the food bank um, to also provide culturally appropriate options for those who may not, um, who may have, cultural limitations to it. Um, this initiative not only improves health outcomes, but also restores dignity and stability for some of the most vulnerable individuals in our healthcare system. As you can see, I developed this really easy to follow checklist food plan where they can check off some food that they see within our food bank. I'm also trying to develop a more quantitative and qualitative study to see what is more preferred food based on um, what our patients express to us. So, in order to continue with this project of implementing our food bank and hopefully expanding it through the other clinics in Portland, we should uh, incorporate other organizations like our local food suppliers, healthcare providers, healthcare providers, food banks, and food banks that carry culturally appropriate options. I also think communicate, excuse me, community organizations would be helpful because a lot of the patients around here are very familiar with their community, and I think that they would prefer um, people who are within their community to help them with these type of challenges that they're having currently. So, in conclusion, completing my applied practice experience at Fresenius Medical Care has really given me the opportunity to strengthen and develop my skills as a public health leader. During this process, I learned the benefits of networking um, and how the company operates on the back end. I was able to understand the importance of structural bias and social inequalities and the experience of the challenges of public health communication between different audiences. Some key takeaways include the importance of cultural competency and understanding chronic kidney failure. Um, Different cultures have different beliefs. It's important that we, as public health leaders and healthcare workers, are equipped with the proper communication skills to best represent and advocate for our patients. It was a very fulfilling experience to be able to represent and advocate for our patients. Being able to create flyers and informational resources in both English and Spanish that includes providing um, these flyers in other languages like Somali, Mandarin, Tagalog, because those are our main patient um, demographic, has helped me to move forward with our food insecurity project. And I hope to implement a qualitative and quantitative survey to solidify the issues of food insecurity for our current and future dialysis patients. So, my reflection. So, this overall experience, I was able to gain knowledge on chronic kidney disease and dialysis treatment in regards to food insecurity and health literacy. Um, I think it helped me recognize both my professional and personal strengths and weaknesses that are vital to the developmental component of being a public health professional, especially within the specialized environment of dialysis clinic. It also allowed me to improve my communication skills, not only with the patients, but with my fellow coworkers, and as well as collaborating um, with with other stakeholders that are needed to improve healthcare overall. Um, Number three, it really, really helped me develop cultural competency. Again, we have patients who are Somali, who are Chinese, who are Filipino, who are Latino or Latinx. Um, we have a very, very diverse population, and they're the majority of our clinic. So it allowed me to understand how being able to to incorporate their cultural beliefs into food insecurity and what is needed for them as a dialysis patient. Number four, I learned about the healthcare system and how to navigate it on the back end as a public health leader. Sometimes, as a healthcare provider on the front, we don't always get to see what the issues are going on the back end and how we can improve the patient's experience as well as their overall quality of life. So that was a very fulfilling experience in itself. And lastly, I was able to implement my knowledge on the social determinants of health, um, meaning that from the beginning of this program, I was able to incorporate everything that I learned about public health in itself, and um, it provided me with a lot of experience and the tools to be able to complete my internship and move forward with my goals for the clinic. Overall, I think that this was a great experience for me, and I look forward to continue working with my patients and developing and implementing this food bank that I can expand to other clinics within the Portland area. I thank you for your time, and I hope um, to collaborate in the future. And I look forward to going out into the field and being a public health leader. Thank you.